hypertension is a big culprit for many things, Coronary heart disease. So heart disease involves obviously the heart and the blood vessels. Right here, coronary heart disease. So involves the heart and the blood vessels. So the blood vessels, when they are compromised, is called CAD or coronary artery disease. And that is due to arteriosclerosis. So arteriosclerosis is the build of plaque in the arteries, which impedes blood flow to the heart. That build plaque, it hardens the arteries. And when the arteries are thick due to the plaque, then impedes the blood flow to the rest of the heart and creates an MI. How do we know that MI happens? Well, we take a picture of the heart by doing an EKG. And how do we know that in the EKG? We look at the leads in the EKG and we see ST elevations. Do you know what ST elevation is? Not yet, right? So when the ventricle contracts, it creates the QRS. The QRS. And the S goes back to the line, and then the T wave, which is the last wave, is when everything goes back to normal before the next contraction. So that ST piece of it gets elevated, and that's when we know that the heart attack is happening. If that ST is depressed, that means the heart attack already passed. But if the ST is elevated, then that means the person is having a heart attack. That's not going to be on your test, it's just FYI. But the hardening of the arteries and all that plaque formation, like I said, is going to impede oxygen and nutrients to go to the muscles of the heart. And when that is, it prevents from blood flow there, oxygen is not going to be delivered, therefore tissue begins to die and ischemia will happen. Make sense? Have you ever seen how they clean the arteries? I kid you not, literally, they put the fat out of the artery and it looks like spaghetti. Like spaghetti coming out, and then the artery becomes flat. And I see it, they put it like that, and it's just like spaghetti. You see it's fallen spaghetti? That's what it is. And all is fat accumulated in the arteries. Yeah, next time you eat spaghetti, say, that's how it looks like. So that's what happened with CAD, is arteriosclerosis, which is narrowing of the coronary arteries due to plaque formation. Then we have CHF, which is congestive heart failure. Congestive heart failure is the inability of the heart to send blood to the parts of the body. What happens when we have left CHF? That means buildup of fluid in the lungs. If you see fluids in the lungs, that's considered a left congestive heart failure. If we see fluids in the abdomen and the lower extremities, people say, oh, my feet are swollen, I'm going to put them up. Those are fluid retention. That would be a right-sided congestive heart failure. Have you guys studied this before?
Yes, for Mr. Bauer.
Yes. Go. All right, so you guys already know this. This is a review then. Let's move on then. The risk factors of CV disease, obviously family, hereditary, is family traits. If that is a risk factor. Race, sometimes no, it's 50-50 there. Gender, no, but age is. About half of the cardiac rehab candidates are young, under 60 years of age. Sometimes above 60 is very hard to do rehab on those patients from cardiac problems, of course. And I will remember that age. I certainly will remember that. Smoking is a big one here. It causes coronary arteries to contract because smoking prevents oxygen delivery, of course. CO2 stays in there and somehow the arteries contract, they flatten. So smoking is not a good thing as a risk factor. Diabetes, sedentary lifestyle, stress, all this can cause cardiac disease, unfortunately. Why stress? Why is stress can cause? Yes. When the person is stressed out, everything contracts, high blood pressure goes up. What did you say? Yes, hypertension, correct. Heart rate goes up. It all that puts stress in the heart, right? This is a potential complications of MI. See, before I go into this, when you guys, for this test, please look at what makes sense. Like in this thing, do you guys, if a patient has a sedentary life, I'm gonna put them on a activity regimen to help, right? If he's talking about immobility, then find the immobility in the question and look at what the answer, because some of the answer may be good. If I say change diet and all that, but if the question says immobility, even though the diet makes sense, don't pick that one. Because that's what I see. The students say, oh yeah, a diet free of fats and all this and eat healthy vegetables, that's gonna help. They mark that one because it looks good. But the question is asking immobility. So I need to find something that's talk about exercising somewhere along the line. I said, but you say that diet was good. I said, yes, I did say that. But what? Look at the question. It's talking about when the patient is immobile, what you're going to do. What are you going to do? So for this type of test, please make sure that you look at the question and kind of highlight what the question is asking you. Because the answers may be all correct, but that's not what they're asking you. So potential complications of MI, of course, is heart failure, arrhythmias, cardiac rupture, pericarditis, which is fluid buildup around the heart, and thromboembolisms, obviously, will be formed. Look at the components of cardiac rehab. The first, if a person has a heart attack and is sent for rehab, they're going to do a thorough medical evaluation. They're going to do a prescribed exercise. So the patient, the exercise will be telemetry monitoring. So the person will have the monitoring attached to them when they go on a walking path or they do any kind of exercises, because they have to do a monitoring the heart, of course. And this has to be prescribed. That's all prescribed exercise. And obviously, the exercise will be based on the ability of the patient. It's not the same for everybody. It's according to the ability of what they display. And that will increase independence from the patient, of course, when they do those exercises. But then yet, There is a misconception. Most of the patients may think that they're gonna be losing weight when they go in this type of exercises. It will not. Cardiac exercises are not meant to lose weight. They are just meant to increase the heart rate and to monitor the heart just for that particular muscle. It's not the regular exercises that we do. Maybe if they ask to lift weights, it's gonna be less than 1 pound. It's just to get the heart up. And what do we detect? Dysrhythmias, obviously, if on that monitor. Most of those exercises goes to patients with coronary artery disease. Walking, swimming, and cycling are great for this type of patient. I'm giving you exactly what is good for those patients. Walking, swimming, and cycling. So eventually those patients are gonna come out of unsupervised exercising. So the telemetry may come up because they're already okay, but they still need to have physician supervision. Remember that, because there's a question about that. I'm just gonna give it to you. Just because they're already off from that exercise regimen, they're already off from the telemetry, the patient must remain under a physician care to continue doing the exercises. And the question may ask, these patients are completely, the prescribed exercises already passed, the patient is totally stable, and they choose to go to the gym, whatever the question asks. So, they still need to be under a physician care. A physician direction, of course. As far as education and nutrition, we have to make sure that salt intake is limited. We need to tell those patients about that. And lunch meats are not, those processed meats are not good for you guys, or for anybody eating meats. Those has too much salt content. Because salt, what happens is that it causes water retention in the body. It's not going to help for the CHF patients. Also increase the high blood pressure. So increase the high blood pressure. And it can lead to heart failure, of course. So make sure that the nurses, as nurses, we're going to educate the patients that canned foods, canned soups, it has high sodium content. All those processed cheese, processed meats are not good for you. I was invited to a farm in the mountains of North Carolina last summer, and they have very nice meat that they cut right there at the farm. The meat tastes different to me, so I couldn't eat it. And then I was so upset that I could not eat it because it tastes different, because it was not preservative, it was not processed, it was the real thing. And I was like, I cannot believe I cannot eat this. And I tried, but I couldn't swallow it. I just couldn't because of the taste. My two boys like, oh, this is good. I'm so glad they did. But when I get the meat from the store, from Sam's, oh, it's music to my ears. But that has some preservatives in there. That has so much stuff that they put on it that is not good. And salt in there, which is not good at all. Omega-3 fatty acids is recommended. However, the latest evidence says that it's not as good as they think it is. On a test, I may put omega-3 just because much evidence is there that it's good to decrease lipids and stuff. Because it's out there, it may be on the test, but recently the latest study says that it